Good morning, all. So today is World Doctors Day. I am going to discuss about a very important aspect of doctors' health today. And I think this is one of the most neglected area amongst us. And we all know that what is our final destination and when we will get the ultimate freedom. But this journey to reach that final destination, what we want, all of us want that this journey should be a smooth one. But unfortunately, but true, that this triangle, what we are going to discuss today, the triangle of time, body, and medicine, is mostly neglected by us. By us means by us doctors and many other professionals too, especially from the IT sectors and also some industrialists, some businessmen, police. So I think this presentation is going to awake us, aware us about what are the wrong thing we are doing. Here we are doing means I am also doing the same mistake. So let's revisit the very important triangle of our life, the time, body, and medicine. So when we are talking about time and body, I think these two arms of the triangle, if we can take care properly, we can avoid being taking the medicines. So let's understand about this time and body concept. And what is important to note that time is not going to bother about what body is doing, but it is the body which needs to follow the rule of time. Why? Because our teachers, the Supreme Lord, said, I am mighty time, the source of destruction that comes forth to annihilate the worlds. Kalosmi, lokokshvaya krit pravrittho, lokan nash mahartu miha pravritta. So that is why if we do not give emphasis on time, then I think we need to consider the third arm of the triangle, that is the medicine. So our body need to follow the rule of time. So to discuss this topic, we will talk about this following contents. First of all, we need to understand the relationship, because when we talk about time in this earth, in this world, we need to consider sun, and we need to understand the relationship between sun and us. So we'll talk about sun and we. We'll talk about a little bit of chronobiology, then how light become a switch and a dangerous switch to us. We often do switch on and light comes, but here light unfortunately switch on us in wrong time. So that also we need to discuss. And finally, we'll talk about what happens if we do wrong thing at wrong time. So first of all, sun is the only source of light and also heat which present periodically to us and all the living organisms, starting from a small plants to a large animal. They all try to adapt their physiology with variable presence of sun to achieve the maximum fitness, starting from a flower plants like Mirabilis, which often known to us as 4 o'clock plant or 6 o'clock plant. They only give us the flower at that particular time. Otherwise, the flowers will not come. So depending on the position of the sun, there will be flowering. Similarly, if we see the movement of the bees, they also follow certain pattern which is dependent on the angles to the sun. So specific position in respect to the horizon of the sun will determine their movement, the bees movement. Similarly, all the creatures, they follow the rule of sun, except we, the human beings. And that is why this presentation had been made. But unfortunately, but true, this presentation was prepared at night between 1 to 2:30 a.m. by me, which is again against the law of sun, law of light. So that is why this presentation is actually meant for increasing the awareness amongst us only. So what is internal clock? They are anticipating day-night cycles and guide all organisms in optimizing their behavior and physiology. Here we need to mention, from our ancestors' time, we worship sun as Namah Savitre Jagadeka Chakshase Jagat Prasuti Sthidinasha Hetave Trai Mayaya Trigunatma Dharine Virinchi Narayana Shankaratmane. So from our ancestors' time, we worship sun. But now we forget to worship sun. Even we worship sun, but at wrong time, not following the actual message given by our great ancestors. Someone may tell me, someone may give some other type of explanation that why only we are talking about sun, because very recently I had submitted one project on Surya Namaskar. So someone told why it is Surya Namaskar, why it is not Chandra Namaskar. I am not against what is Chandra Namaskar is, but why Surya Namaskar is important, because due to the sun we are present here. This world exists. And a typical formula, if we forget, which was learned from our childhood biology class, the formula for photosynthesis, that also required this sunlight. And actually, the oxygenation starts in this world by first time the cyanobacteria and those carbons which present just below the sea level. So that was due to the sun only, the sunlight only. So we all need to acknowledge the contribution made by the sun and need to follow the rule of sun. And this is why in this presentation also, we can see lots of plants who are actually following the rule of sun, and they are present till long days only to help others. They are giving us the oxygen. So the picture of the plants given in this particular presentation are for the importance, to give the importance of the contribution from the sun only, because without sun they will not exist, and if they not exist, we are nothing. So now, what is chronobiology? This is the science or study of the effect of time, especially the rhythms on living organisms. So when we talk about circadian rhythm, that is the 24-hour cycle. So any biological process that displays an endogenous intrainable oscillation about 24 hours, that is circadian rhythm. What is the other types of rhythm that exists? Number one, the ultradian rhythm, more frequently than 24-hour cycle. So most common example is our rapid eye movement during the time of sleeping. Or when I am talking, I am inhaling, my heart rate increase. When I am exhaling, my heart rate decrease. So that is the sinus rhythm, the respiratory variation of the heart rhythm, heartbeat. So that is also an example of this ultradian rhythm, the sinus rhythm. The hunger cycles, of course, due to the virtue of this ghrelin hormone, they also follow this ultradian rhythm. Now, what is infradian rhythm? So, infradian rhythm means that is more than 24 hours, but less than 1 year. So, here, most commonly, we know about the menstrual cycle. Apart from that, there are certain mood disorders which follow this rhythm of infradian rhythm. A specific season, maybe autumn, maybe spring, before spring, they follow this infradian rhythm, like seasonal affective disorders. And what is circannual rhythm? This is an example of 1 year cycle. So 1 year persists in absence of environmental influences. Most commonly, we know about hibernation by certain animals, certain migration, those who visit the great migration that happens in Africa, they can also understand this circannual rhythm, and also some specific plant growth, some flowering. These all are example of circannual rhythm. So in case of cortisol hormone secretion, they generally follow the ultradian rhythm. There is variation, we all know, but that also starts in the hypothalamus, our central clock, the suprachiasmatic nuclei. They give the impulse to cortisol releasing hormone, then to acetate formation in the pituitary, and ultimately they promote the cortisol release. So this HPA axis generally follow the ultradian rhythm. Apart from that, in our brain, the arcuate nucleus mediated hypothalamus to arcuate nucleus, and then finally the substantia nigra, the other neurons, those motor activity, they also follow some ultradian rhythm. And commonly this HPT axis, the hypothalamo-pituitary thyroid axis, they follow the infradian rhythm. And again, that starts from the suprachiasmatic nuclei stimulus to thyroid releasing hormone to TSH from pituitary, and ultimately the T3, T4. So from in the thyroid gland. So again, that is we know the negative feedback loop is happening. So this actually follow the infradian rhythm. Here also we can see few examples of infradian rhythm, ultradian rhythm, and of course the circadian rhythm. So this we need to understand, and there are certain systems which follow both the ultradian and circadian rhythm. Like cortisol. In case of melatonin, they also follow both the circadian rhythm and the infradian rhythm, like that. As already mentioned, the heart rate, they follow the ultradian rhythm. So when we talk about circannual rhythm, whether it exists in human, that is a debatable issue. But this was a paper which had shown we have impaired thermoregulation mechanisms that could explain the winter peak of insulin resistance among the elderly people without diabetes, and the seasonality of lifestyle factors that also may explain this seasonality of the glucose. But food for thought is we need to explore it more, whether there are certain issues, certain seasonal exacerbation of certain disease is due to that circannual rhythm. We need to explore it. And when we are talking about biological clock, we all should worship the contribution of these three great scientists, Professor Hall, Professor Rosbach, and Professor Young, who had shared the Nobel Prize in Physiology or Medicine for their discoveries of genetic and biomolecular mechanisms that help the cells of both plants and animals to mark the 24-hour cycle of day and night. And what was their greatest contribution is that they had identified, located the genes responsible for this TTFL, the transcription translational feedback loop. And that is that consists some genes which are regulated by their own protein products. So here we will understand about the clock gene or clock protein and BMAL1 protein, which acts as a transcriptional activators of cryptochrome and period genes. And ultimately, they will encode proteins that replace those complex of clock and BMAL1 with a periodicity of 24 hours. So if we start from prokaryotes, there the system was post-translational oscillation mechanism, or also known as PTO mechanism. The cyanobacteria, when we talked about photosynthesis, we are grateful to this community of cyanobacteria because they were the first team which was doing the photosynthesis in this world and give us the oxygen. By the virtue of that, we got other living organisms. So they use KAI, ABC, A or B or C as a core oscillator. Finally, when we talk about eukaryotes, they have the transcription translational negative feedback loop. And also eukaryote use those PTO, that is post-translational oscillation mechanism, using some redox oscillator with some PRX protein. So in this slide, what we can see, how it was PTO in prokaryote, then eukaryote use both the PTO and the other mechanisms, redox mechanisms. And finally, the eukaryotes had developed that transcription translational feedback loop. And in mammals, we need to understand those two specific protein, the clock and BML1, as a positive clock gene, and as a negative clock gene, the period and cryptochrome, they are responsible. And by together, these positive and negative clock elements, the clock use the controlled pathway. But again, we need to understand, re-emphasize the importance of sunlight here, because they are the most prominent environmental zeitgeber who regulates these positive and negative clock elements. So here also we need to understand the biological clocks of various organisms. They are derived from the selection pressure given by the natural environment. And selection pressure drives the biological clock to become more complex and refined. Great oxygenation event, or GOE, which had began 3 billion years ago, it becomes more complex and manifests in different forms on different species. So it was initially only the PTO mechanism, the post-translational oscillation mechanism. So from post-translational oscillation mechanism, ultimately the development of transcription translational feedback negative loop. So that is a trend of step evolution. So in this diagram, we can see what happened after great oxygenation event, starting from the prokaryotes who use that KAI-ABC oscillator to other types of oscillators, and finally the period oscillators in different animals. And we mammals are now enjoying the TTFL mechanisms, transcription, translational feedback loop mechanism. Again, in this slide, we can see the importance of the PAR and PRI, which enters, and there is an again direct relationship of stimulating by the zeitgebers like sunlight, and ultimately they will inhibit that degradation of BML1 mediated pathway. They promote the PAR-PRI pathway, and ultimately the PAR-PRI will divide into two specific molecules into the cytoplasm nucleus. And at night time, what happened? The PAR-PRI gene that will be separated, and that facilitate the BML1 mediated pathway and doing the mechanisms the in a just opposite way. And the PAR-PRI complex will be inhibited here, which was activated during the daytime. So here we can understand how light is important, how that light zeitgebers control either the PAR-PRI or the BML1 mediated pathways. So this is why we need to respect this machine of time and body. The body machine is actually regulated by the time. And if we are not properly maintain this body machine and not follow the rule of time, we'll face problems. So we all know we respond primarily to light and darkness in all organisms' environment. And this light, this time, the circadian rhythm generally develops an internal body clock that regulates our 24-hour cycle. And if we are not follow that, we know we have the suprachiasmatic nucleus in our hypothalamus, which is the central pacemaker to this clock, or we can call it as a central clock. But also we have multiple peripheral clocks, but all those peripheral clocks follow the rule of central clock. So if the central clock is not working properly, all those peripheral clocks will be failed. So we need to take care of those because they influence our sleep-wake cycles, different hormone release, eating habits, our digestion system, body temperature, blood pressure. If we disrupt this rhythm, so irregular rhythm, that will lead to sleep disorders, obsessive compulsive disorder, obesity, hypertension, diabetes mellitus. And we are talking about our doctor's health. So there are different studies are coming that suggest we face untimely death, untimely complications, diseases. Why? One of the cause may be ignoring the rule of time and not properly running our body machine. So without following the rule of time, if we are running the body machine, that will lead to different types of complications that is going to happen. So in normal physiology, this is the circadian rhythms within us. So if we start our day at maybe 6 a.m. or before that also, if we do, because in our literature, there was a thought that to do some meditation at around 4 a.m., which is also known to be a Brahma Muhurta. Why? Because we have two types of autonomic nervous system in general, sympathetic nervous system and parasympathetic nervous system. So during the night time, maybe after 9 p.m., our parasympathetic nervous system is taking care of us and the sympathetic nervous system is going down. And in the morning, the sympathetic nervous system is going to take care of us and our parasympathetic nervous system is going to be passive. But at that time, at that juncture, if we can stimulate the parasympathetic nervous system, because meditation actually helps us in building our parasympathetic nervous system activities, strengthen that vagal tone, vagal nerve activity, the parasympathetic nervous system activity. So if we do that at that morning, so what happened? The steep rise in the sympathetic nervous system activity, which is responsible for increasing the blood pressure and so other metabolic complications, that can be little bit diminished because of our extra activity done by meditation in form of increased parasympathetic nervous system activity. So we need to know in around 6 to 6:45, there will be a sharpest blood pressure rise. And that is why in many cases, the cerebrovascular accidents that happen during that time, the ischemic cardiac events that happen, acute coronary syndrome happens at that time. So you need to take care of that issues. Melatonin secretion stops completely. We know the melatonin is the sleep promoting hormone at around 7:30 a.m. And at around 10 a.m., we have the highest level of alertness. Then 2:30 p.m., we have best chance to have a coordination, fastest reaction time, greatest cardiovascular efficiency and muscle strength at around 5 p.m. And we have our highest blood pressure at around 6:30 p.m. and body temperature at around 7 p.m. So our sympathetic nervous system have their maximum activity at around our evening time. After that, around 9 p.m., when melatonin secretion starts, and that was the time when our sympathetic nervous system is going down and parasympathetic nervous system is taking the upper hand. But what actually we did? We did the maximum mobile chatting, Facebook viewing, WhatsApp messaging, and all those television viewing during that time. That was the time when we switch off us from this world. We should go to our bed and we should sleep. But from the very early of our life, what we can share, we generally try to read. Even when we were when we were the MBBS students, that time the night was the best time to read. In the hostel life, generally up to 3 a.m., 4 a.m., we read, and then we go to our bed. So from the very beginning of our life, we are destroying this normal physiology, and that is going to harm us. And we don't know whether it is the cause of, or it is one of the major cause behind the premature deaths amongst doctors. And similarly, this thing happened in the IT professionals, the engineers, because they are also vulnerable to this same type of lifestyles. So that is why we need to aware us, at least what happened to us, that should not be done to our next generation, to our children. So that is why we need to increase the awareness about this body machine and how that should be controlled by our time. So again, we can see in this diagram how our clock, our body clock, is telling at what time what should be done. And this is why this is mostly important for application of different medicines, because according to that we can target our pathology. But before that, again, we need to say, if we do right thing at right time, we do not require medicine in general. So during the morning, what happened? The cortisol, the testosterone, the catecholamines, those hormones start secreting. And you can see the life of a farmer. That is most physiological. Yes, they are following the ideal rule of this time. Their body machine is following that. They wake up very early in the morning. They went to their place, field. They are doing activities, farming that time, starting from 8 a.m., 9 a.m. They have their best coordination that time, alertness that time. They have their muscle power that time. Their testosterone is going high, so their muscle activity will be more. So they are following the right thing, but we are not. The activity of the RAS system, they are also going to high. The platelet aggregation, blood viscosity will be more. So this is why the early morning is a vulnerable time to develop different types of disease, like as we had mentioned, the cerebrovascular accident, the acute coronary syndrome, etc. Our hepatic blood flow will be more during the night, during the early morning. And that is why some specific drugs will be beneficial if we take it in the morning, or our heart rate will be more, our blood pressure rise will be there. So we need to take care those early morning blood pressure surge. During the afternoon, we have more secretion of insulin. Our adiponectin will be more. So during the afternoon time, we becomes little bit more insulin sensitive. And we have more diuresis that time, not in normal physiology. Our body temperature will rise. We have more airway patency. In the evening time, again, we have a secretion of leptin. The gastric acid secretion will be more. Our uric acid secretion will be more. And our HMG reductase activity will be more. So synthesis of cholesterol will be more. So that is why, again, we need to target those events, and we need to use specific drugs. Like, for an example, very common example is statin. Very common examples to reduce the nocturnal acid secretion is giving H2 blocker during this evening time. So these are some important physiology which we need to remember for application of medicine. And in night time, there will be secretion of certain hormones like melatonin, growth hormone, ACTH, TSH, prolactin, and also separate different types of cytokines like interleukin 6, TNF alpha. Some patient will tell us, I have very specifically who are suffering from neuropathic pain. They will suffer more during the night time because of this type of cytokines. So we need to target those patients. We need to give some, if we are at all using NSAID, at least we need to cover those nighttime secretion of the cytokines so that the patient will get some benefit. So that is another explanation why we use NSAIDs at night time. This could be a beautiful pictures, but this is not at all good for us. This is a picture may be taken from some satellite during some night time, or it could be prepared like just for a graphical design. Someone may prepare this, how a Diwali night is looking from satellite. But we need to understand the exposure to light after sunset tricks the body into thinking it is still daytime, and that delay the onset of biological night. So we need to understand that light as a switch which is going to on us is actually harming us. We need to prevent that harm. So central pacemaker is already we had told the suprachiasmatic nucleus present in the hypothalamus. We have our melanopsin photoreceptors in the eye which detect light. The suprachiasmatic nuclei is then activated. They suppress the production of different hormones, including the melatonin by the pineal glands. So that delay the onset of sleep. And what is important in this slide, you can see a beautiful picture of a cappuccino, a cup of coffee here. But this is also important to note that this type of wrong food during wrong time is going to harm us. So exercise or food may shift the clock. So wrong timing is not at all required. So house with clocks in every room and every corner we have. We already talked about our peripheral clocks. Yet in one way or another, they work in an organized way. The timing of all these various peripheral oscillators, peripheral clocks, can profoundly affect metabolic activity, immune cell proliferation. So the other peripheral clocks, if they are not working properly, we'll have metabolic disease, immune disease, cancers. So we need to control this light switch. So light controls the body clock by activating this suprachiasmatic nucleus. So we need to prevent this untimely activation of the body by this light switch. That is very important. If we have repeatedly these desynchronized clocks, what happens? That will lead to different types of metabolic diseases. Starting from the circadian disruption or shift work, which is very common amongst us, the doctors. engineers, the IT people, the policemen. Sometimes we have a night eating, breakfast skipping, sleep restriction, sleep fragmentation, high fat diet, very common again amongst us, the doctors, feeding during rest period. So that all lead to these caused desynchronize in the adipose tissue, the glucose homeostasis and leptin homeostasis, and ultimately the very important clock components, very biological clock components, the clock, CLOCK and BML combination in the nucleus, that will be changed. So change happened in the metabolic gene expression. So finally, we need to understand the wrong thing should not be done during the wrong time, because this was from a very interesting study conducted in critically ill patient. Wrong thing, wrong time, leading to circadian desynchronization in critically ill patients. That sleep-wake inversion, sleep loss, delirium. We know about the critical care unit psychosis, ICU psychosis. Maybe one of the result of this circadian desynchronization. Poor compliance with physiotherapy and rehabilitation. Also, very true, the continuous feeding during the night time that leads to metabolic dysfunction. Invasive interventions at night, not if it is absolutely required, we should not delay that. But if that can be delayed, it is better not to do at the night, because invasive intervention at night results in impaired wound healing. So that is why in that particular paper, they had mentioned about this critical care chrono bundles. What should be done in the ICU? They also mentioned the time-specific interventions in the ICU. Like during the daytime, the patient should be exposed to bright daylight. The feeding should be done during the daytime. The physical activity, if at all possible. Nursing and medical interventions mostly to be done during this time. And during the night time, from 9 p.m. to 8 a.m., minimal light should be available there. Eye mask should be used properly. No feeding. You can use those earplugs, because those sounds, sounds are very, you know that who are working in the ICU, they know this sound is so much distracting. Minimize talking. So nursing staffs, doctors, other healthcare professionals should minimize talking. Mute the monitors if possible. No routine washing that time. Avoid cohort clinical interventions during the night time. Now, finally, we need to understand what is sleep. This is a recurring, reversible, neurobehavioral state of relative perceptual disengagement from and unresponsiveness to the environment. So this is obviously a recurring, reversible, neurobehavioral state, relative perceptual disengagement from the environment, and also unresponsiveness to the environment. And this is typically accompanied by postural recumbence, behavioral quiescence, and closed eyes. But here we need to understand two types of drives when we are talking about sleep, because our circadian alerting signal is there, and also the homeostatic sleep drive. You can see in this picture, This is taken from an YouTube presentation, very beautifully explained here. The hemostatic sleep drive here you can see, they give us to have sleep, and the circadian alerting signals, they make us awake. So if we have more circadian alerting signal, so we will have more wakefulness. If we have more sleep drive, then we will have more sleepiness. So what happened? This is a perfect balance between these two. So you can see when after 9 p.m. we have decrease in our alerting signal, and that time we have the fullest sleep drive. So ultimately we will feel asleep. But when we are sleeping, we are regaining our sleep drive. That means our sleep drive will be again least, because that least sleep drive will give us a maximum wakefulness when we are getting up. So this is the balance between two signals, the circadian alerting signal and the homeostatic sleep drive, that make us sleep or make us awake. One very interesting finding, this drive, this decrease in wake propensity, maybe around 2 p.m. like that. What happened that time? We also feel, many of us in Bengali, we mention it as bhat ghum. After taking some rice in the lunch, we feel some sleepiness. But that is actually due to the decrease in circadian alerting signal and increasing in homeostatic sleep drive. But believe me, if you were feeling sleepy, if we just take one small snap, maybe 5 minutes, what happened? The homeostatic sleep drive, which was increased, that will be decreased certain, and that also give you more wakefulness after getting up. So this is again a very interesting issue, how our body clock is alerting us when to sleep and when to awake. So very recently, the ADAEST came up with 5S concept, that is, sitting is something which is also a new smoking. So we need to break up the prolonged sleeping, then stepping, how to increase the step. If we can just increase the step by 500 per day, that is also going to reduce almost 2 to 9% of our cardiovascular morbidity and all-cause mortality. Then the sweating, how important is more than 150 minutes per week moderate to intensity physical activity, or if we are doing some vigorous intensity activity, that could be a 75 minutes per week, that is going to help us. Physical functions, frailty, sarcopenia. So how the strengthening, another S, that is strengthening, is going to improve our muscle, and that can help us in reducing the insulin resistance in the muscle. So strengthening and different types of adaptation in resistance program that can give us this strengthening issues. Finally, the sleep. So as we are talking about our time body, we need to keep emphasis on this sleep timing, sleep quality, and sleep quantity. It should not be too long, more than 8 hours, or should not be short, less than 6 hours. The quality should be good. It should not be irregular sleep during the night. And often we doctors have to take some calls during night time, and we have irregular sleeps, and that is why again we are vulnerable to have a poor quality sleep, leading to different types of diseases. So poor quality sleep means that also related with insomnia, obstructive sleep apnea, restless leg syndrome, and so on. But in this guideline, they had mentioned clearly how the chronotype is also important for our sleep health. And that is why they're telling us to follow the early bird who is going to bed early and get up early, not to follow the night owl who go to bed late and get up late. Because the night owl chronotype, they may be more susceptible to inactivity and poorer glycemic events versus those morning chronotypes. That means who go to bed early and get up early. So that is why you can see the chronotype, the consistent timing of sleep, that is, the evidence are there in improving the glycemic status like glucose and HbA1c value, improving the insulin resistance status. They also decrease the depression, and overall sleep is adequate. Sleep is very important for all those parameters. But again, the concept of personalized chronomedicine is important. It may be maybe there is some exception, but it is true that some of our great teachers who generally saw their patient up to 2 a.m., 3 a.m., they went to take a dinner, went to bed maybe at around 5 a.m., get up from the bed at around 11 a.m. or 12 noon, then again do their work. But they are healthy. They are still doing the same thing at their age of 87, 88 years. But it could be some other confounding variables, or it could be we should look for the personalized chronomedicine. That means the chronotype can be variable. So we each may share different genes of different chronotypes. So that we need to explore. And for that, we need to do more research on this field because this is a virgin field. So increased accuracy of the results and more tailored experimental interventions need to be given. Better understanding of interactions. So that is why the education and technology using different AI tools that could be helpful. Obviously, the personalized chronomedicine should be practiced. Treatment or chronotherapy timed with body clock. If we are using some medicines, drugging the clock may increase the therapeutic efficacy and decrease the side effects of the medicine. So that is our overall goal for this medicine. And when we talk about health as a whole, a holistic approach, so circadian health is something which need to be given emphasis. How to synchronize with external jet chambers and synchronization of all internal clocks. So that is important. How we should follow the rule of perfect in training those biological clocks, starting from the central to peripheral clocks. How to improve the sleep-wake quality, the timing, amplitude, and duration. So these all are important. So circadian precision medicine, we need to look for, which could have both the research and therapeutic outcome benefit, and ultimately that will lead to health outcome. So concluding the first part of my presentation here, the part 1, will take the part 2, which will be more focused on the medicine part. That means the chronomedicine part. the triangle of time body we had discussed. Here the two sides. The final sides, the medicine will be discussed in another slides. Slide shows another presentation. But concluding this part, the most importantly, the circadian pacemaker, which resides in the paired suprachiasmatic nuclei, and that influences a multitude of biological processes already we had discussed. And any disruption of these rhythms, those are risk factors for cancer, metabolic syndrome, cardiovascular disease, sleep disorder, different psychiatric illness, including depression. When we talk about our clock genes, which control a vast array of circadian rhythms involved in physiology and behavior. So we need to explore these clock genes more and more. And obviously, the circadian precision medicine is something which is waiting for us. Maybe a couple of years later, we'll know better about this circadian precision medicine. So we had started with a slope about the importance of time, but it is also important to note we need to enjoy the life, and time, we need to move beyond the time too. And how we can do that? We know our destination is fixed, and we know that is the time when we'll get our freedom. But at the same time, if we stop just thinking, okay, so I have to reach there either way, so I will not follow the rule, that is not going to help us. Because again, the God told us, conquer your foes and enjoy the prosperous rulership. These warriors stand already slain by me, and you only be an instrument of my work. So we are only nimitta matra. So all the other things already decided by the Supreme. So our work is to follow the rule of Supreme, to follow the principle of the time, and that will give us a smooth journey to the destination. Yes, as we had discussed, the next topic, the next part of this presentation of time, body, medicine triangle will be focused on this chronergy. What is that? Chronergy means the circadian variability of the drug effects. Results from circadian modulation of multiple biological functions, as already discussed, which affects our pharmacokinetics of those drugs. So we can tell it as chronopharmacokinetics. And from the cyclically changing the sensitivity and affinity of the targets for pharmacological interventions for the drugs, which is also termed as chronesthesia. So thank you once again. Thank you for your listening. I just hope that all of us can reach our destination and get the freedom, but that path will be very smooth, very healthy. And healthy means, again and again, we need to revisit the definition of health. Health is not only something which consider the physical well-being. It is also the mental, social, and now another important dimension is the spiritual well-being. So thank you once again for your patience hearing. If you have any question, any comments, specifically any counter comments, you are welcome, because this science is evolving. With your comment, we also can learn more. So Thank you very much for your patient hearing.